Carbon monoxide, chemically known as CO, is a colorless, odorless, explosive, but most importantly, poisonous gas.
Carbon monoxide is a poison because it forms a permanent bond with the hemoglobin and therefore stops the hemoglobin to carry oxygen as a carboxyhemoglobin to go and get the oxyhemoglobin. And when that function is stopped, there is a lack of oxygen to the brain and the rest of the body. Typical symptoms of the carbon monoxide poisoning is being nauseous, headache, and sometimes similar symptoms of the flu. These are most common symptoms, and also weakness, being again dizzy. Well, chemical cause of poison is CO, is carbon monoxide. Actually, the function of the hemoglobin is carry the oxygen through the body and gives to the living cell. What happens in the living cell gives up carbon dioxide, which combined with the hemoglobin to form carboxyhemoglobin, which is a not very strong bond. And when the carboxyhemoglobin get to the lung with the presence of oxygen, gives up CO2 and accepts oxygen and carries the oxygen through the body. So if there is more than 10% of the hemoglobin in the body combined with CO, this is a permanent bond, and that amount of the hemoglobin is not capable of carrying oxygen through the body.
Some of the most common ways that I see individuals as a firefighter exposed to carbon monoxide gas are those individuals that live in residential structures with inadequate heating appliances. In addition, we also see individuals who may operate their motor vehicles while they're in a garage without proper ventilation, hence forcing the carbon monoxide gas into the improperly functioning heating ducts, hence poisoning the individuals in the structure.
Well, it mostly depends on the concentration of the carbon monoxide in the air. For example, if there is a small leakage of carbon monoxide through the furnace at home, it may take prolonged time, few hours, or even sometimes days to have substantial effect. But however, if it's a substantial amount of carbon monoxide, like a car is running in the garage with the door closed, it will take probably around 10 minutes for a person to pass out, and after that, no more than 5 minutes to cause death.
Carbon monoxide poisoning presents itself in a number of different ways, anywhere from headache, dizziness, vomiting, or nausea, all the way up to cherry red skin in the most extreme cases. We treat this in the pre-hospital setting with 100% pure oxygen at extremely high levels, 15 liters per minute or greater. Once we get them to the hospital has much greater ways to take care of these problems.
In the hospital, what they do, if it's very severe and the patient is unconscious, they can put them in the pressured chamber with maximum oxygen, usually 50-60% oxygen. Recovery a lot depending on the severity and the condition of the patient. If the patient is unconscious, it may take longer. If the patient is conscious, with giving the oxygen by mask or through cannula, which is by the nose, it may take a couple hours. The symptoms, which is headache, nausea, will disappear and patient recover. If it's severe and patient is unconscious, it may take longer, and maybe 2 hours, 3 hours or longer for the oxygen therapy to take effect. Depending on the length of the time that patient has been unconscious, if it has exceeded certain number of the minutes, oxygen has not reached the brain cell, Some of the brain cell may be damaged permanently and they have permanent damage, but in most instances, if it is caught on time, the patient recovers without any symptoms.
As a fire department employee, we do highly recommend carbon monoxide detectors in all residences, but especially where places where people are going to spend durations of time asleep. The carbon monoxide detectors can be picked up at any local hardware store for a reasonable price.